everybody, it's Dr. Joe, and today I'm going to show you some stretches and exercises for cervical spondylosis. Let's get started. Disclaimer alert, disclaimer alert. Special disclaimer alert. Like always, get a proper diagnosis, but especially for your neck, there could be a lot of stuff going on. Make sure you get the right diagnosis first, because some of these movements that we're doing, the stretches and exercises, might be contraindicated for certain diagnoses. So make sure you get that right diagnosis before you start any of these. So spondylosis is just a fancy term for age-related wear and tear degeneration in the spine. So doesn't sound fun. A lot of times it's not fun. It just kind of makes it achy, sore, sometimes stiff, especially in the cervical area. So getting some motion, stretching everything out usually makes it feel a little bit better. So let's start off with just some simple range of motion exercises where you're going to start off just by turning your head over, almost like you're looking over your shoulder, but try and keep your head upright so you're not coming down like this. You're just turning straight over, looking the other way. Hold it for about 10 or 15 seconds. Come back nice and smooth the other way. Same thing, just holding it, getting that nice stretch in there. You want to be comfortable, you don't want it to be painful, and then go back and forth about 5 times. The next one is going to be a side bending with your head. So you're going to go over, but you want to take your ear to your shoulder. You don't want to take your shoulder to your ear. So you don't want to hunch up like that. Keep your shoulders nice and relaxed, and then just come straight over. So again, it's this movement, not this movement coming over. So bending over, trying to touch that ear to that shoulder, hold it about 10 to 15 seconds, and then come back up the other way. You can probably see a little difference there. And then do, again, 5 on each side. Then you're going to do a flexion extension. So just coming down, bringing the chin towards the chest, holding it there again, 10 to 15 seconds, and then come back up looking at the ceiling. 10 to 15 seconds. Now, if you have any kind of dizziness issues, be very careful about coming up looking at the ceiling. So maybe not coming up quite as high until you make sure that you don't get dizzy when you do that. And again, 5 times, 10 to 15 seconds. Now, going into some exercising, we're going to do the isometric movements, which is you're making the movement, but you're preventing yourself from moving. You're pushing into your hand that you have there. So again, we're going to go back to that rotation side to side, but this time just place your hand on your temple and gently push into it. So your head's not really moving, but you're giving it just a little bit of pressure, activating those muscles. Hold it for 3 to 5 seconds. Switch sides, and then again do 5 on each side. With the head bending, then same thing. So now you're going to push down that way. So it's going to be that movement, pushing in and coming back. And then same thing on the other side. So doing that movement, but not really going anywhere. And then coming down towards your chest, just place your palm on your forehead and then push inwards, holding it for that 3 to 5 seconds, and then placing your hand on the back of your head and pushing like you're going up that way, 3 to 5 seconds. Now you're going to do some more stretches. You're going to go into stretching those trapezius muscles, which are the ones in the back that kind of hold that neck area into place. Those are the big ones. There's a lot of little ones on the inside, and these are the big ones on the outside. So to stretch your trap, sometimes you just can push your hand down. I like sitting on it because that holds that shoulder into place so you can get more of a stretch. And then just take your hand, kind of hold it on the opposite side, and gently pull over to the side, holding that stretch for about 30 seconds. Now, again, trying to keep your head in that alignment going this way, not turning your head this way or that way, and just pulling over. So again, doing that for 30 seconds. Switch sides, and then do that 3 times on each side. Then the last stretch is going to be the levator scapula stretch, which is that mean one in the back that a lot of times gives you that trigger point right there. A lot of times you can just press and go, oh, that's the spot. And the reason those are usually so sore is because when you're stressed, you kind of hold your shoulders up like this, and those levator are the ones that elevate the scapula back there. So a lot of times if you're like this, it ends up overworking those muscles. The way to stretch these muscles is an interesting way. So the side you want to stretch, you're going to take that hand and just kind of put it on the back of your shoulder where that scapula is. So your elbow is kind of going either straight up if you have a lot of flexibility there, or just up at about a 45-degree angle. Take your other hand and put on the back of your head, up and back, and you're going to go down at an angle like you're looking at your opposite knee. So not straight forward, not all the way out to the side like the trap, but at that 45-degree angle. So coming over like that, and try and keep that other side up as high as you can. You should feel a little stretch through there. And the more you pull, the more of a stretch you'll get. So again, holding that for about 30 seconds, and then do 3 on each side. So then switch sides over towards the other knee, and then holding it there. There you have it. Those were your stretches and exercises for cervical spondylosis. If you have any questions, leave them in the comment section. If you'd like to check out some other videos, go to AskDoctorJo.com. Don't forget to like us, and remember, be safe, have fun, and I hope you feel better soon.